Many dentists struggle in figuring out the right approach to new patients. There are a wide range of potential pathologies involved in this decision process. Let me list a few of these potentially distorted thoughts. I only want good patients. New patient exams just fill up my doctor and hygiene schedule. It's good to make new patients wait to get into my schedule because it shows how popular we are. And on the other end of the spectrum, we don't need many new patients because our existing patients keep us busy. Or, I need 50 new patients a month in order to keep busy. While some of these might actually sound rather humorous to you, the reality is that each statement is built on some grain of truth. However, most of these distort the purpose of a dental practice as an actual business. Many times we dentists do not treat our activity like an actual business enterprise, but instead think of it more like a high-paying job that happens to require some other people to help make that possible. That's a very different mindset than one would actually create, a real business. An actual business is designed for growth. It plans for how to achieve this. It invests when prudent rather than when required, and as a result becomes better and better and better every year. So what does that have to do with new patients? Pretty much everything. If you want to have a business, something beyond a good job, you need to somehow accommodate growth. And growth requires new patients. After all, if you practice long enough, eventually you get all the dentistry done for your existing patients. I know that's only partially true. But a good dentist can easily see 80% of the dentistry completed for the long term for their existing patients. That's a practice killing model. Therefore, if you don't want to be that doctor, you need new patients. There are a certain number of senior doctors that are skilled in multiple phases of care and as a result can survive with 15 to 20 new patients a month. This is because within a limited number of new patients, there's a few that have a great need for dental care. And with the skilled office and a coordination team, they're able to diagnose, motivate, and treat these patients for much of that needed work. At the other extreme, and often discovered painfully by expanding practices that casually add an associate, mainly to give the senior doctor a cushy schedule, there's the uncomfortable discovery that the new associate needs a far greater number of new patients in order to be able to earn a living. Often the senior doctor gets all bent out of shape about this. Then to add to this, the practice has absolutely no idea how to expand from that 15 new patients to the 50 plus needed right now. This is often the primary cause for first-time associate failures. The associate starves while the senior doctor resents the added cost to support this endeavor. They end up thinking of the associate's an ungrateful, poorly educated freeloader, and the result is that many practice owners never attempt to ever risk repeating the experience again. When in fact, they actually needed to own the solution, which was both associate training and more new patients. But there are also some variations on this theme. Sometimes the office in a growing part of the country also has a backlog of work that's built up over decades in practice. It seems as if this pile of work will never end. My earliest associateship was in a situation like that. The practice has gotten to the point where it was a 6-week wait for a crown and bridge appointment. This had gone on for years. When I was hired, the office added one room to accommodate me, and the senior doctor cut back by about a third of his time. How long do you think it took me to cut back that backlog? Answer, about 6 months. I'll have to save the rest of that story for another day, but I assure you that it was very interesting. So just what should you do when adding doctor capacity to a full practice? Actually, unless you're in an area that is completely devoid of dentists, in which case you often have a hard time hiring associates. Ironic, isn't it? Anyway, if you're adding your first associate to a busy solo practice, you'll probably need to start marketing and increase your new patient capacity a good bit before the associate onboarding. I know that sounds counterintuitive, but you need to be sure that you can attract these new patients and retain them. You can see how this is a little bit tricky. In my mind, the best and easiest way to get ready for expanded associate utilization is to expand hygiene hours a lot. You need to shorten the wait for a new patient entry into the practice to a matter of days, not weeks. No, the patients won't think that you're needy if you can get them right in. Do you think that Starbucks is needy if you don't have to wait till tomorrow for coffee? Of course you don't. In fact, you're kind of hacked off when there are 10 people in line and you're wondering why the idiot manager isn't adding more baristas. Be accessible. Plan for growth. There's plenty to be had, but you have to make sure that people know why they should choose you. If that's not clear, fix that. The humor in all this is that many times your practice has been chosen by the new patient simply because you're willing to say, come on down. Think of it this way. From the perspective of your existing patients, if they have to wait to get an appointment, why should they tell their new neighbor to come to see you? It'll only make their wait for care longer. Fix your capacity problem. The physical part of adding treatment rooms, it never costs more than 10% of monthly production. Just do the math. Here's to your future success. Thank you.